Good afternoon, everyone. This is Dr. Moreau with Kozele Call. As promised, I'm here. I'm going to be here with you every Sunday to share information. And we hope that when the information will be valuable to you. And we also hope that you will share that information with your family members or friends so that way they can also benefit from that information. So today we're going to talk about anxiety disorder. As I know, there are many anxious people out there. Tomorrow we have a new president. President Trump is going to be inaugurated, and a lot of people are feeling anxious. So we don't know what's going to happen. There might be mass deportation. Things may. So we don't know. So we're gonna let everything be up to God, and as citizens of the country, then we have to continue our business. So we have to, respect the law, be a citizen. So that way you don't have to be stressful about what's gonna happen in the next 4 years. And 3.5 years from now, we'll have elections and we'll have a new president. So this is how it goes. So as always, I'm going to invite as many people as possible, and then that way we can go ahead and get started with the presentation. Almost done with invitations, and then we'll go ahead with our presentation. All right, so today again we're gonna talk about anxiety disorder. Tomorrow we have a new president. I remember when I came here in 1985, we had President Reagan in power. And 88, we had a new president. We had President Bush number 1. And from Bush 88 to 92, we had President Clinton. So Clinton spent 8 years in the White House from 92 to 2000. So in 2000, we had President Bush number 2. So he also spent 8 years. So from 2000 to 2008, we had President Bush. Then after Bush, we had Obama. So from 2008, Obama also spent 8 years in the White House. So we had 2016. So 2016, we had President Trump. Trump spent 4 years. 2020, we had President Biden. And now, 2024, we have President Trump again. So 2028, we will have another president because President Trump cannot be re-elected because he already spent a previous term. So as you know, we have a Congress controlled by Republican. The Senate is controlled by Republican. The White House, of course, is Republican. The Supreme Court is Republican. So as you know, when you are faced with that situation, laws can be changed. Laws can be changed, and of course, you have the FBI, CIA, all of those institutions. They have Republicans, in charge of them. So even the Attorney General is going to be Republican, of course. So law is going to be changed, and we hope that we will not be impacted by these new laws. So today we're going to talk about anxiety disorder. I thought it would be appropriate to discuss that, as I know many of us are feeling anxious these days. So what is anxiety disorder? So we're going to talk about what it is, the different types of anxiety disorder. We're going to talk about the symptoms and causes, the diagnosis, and whether or not there's any treatment for it. So anxiety disorder is a mental health condition. It's normal to have some anxiety, right? So if you have to tackle a problem at work, if you have to go to an interview, if you have to take a test, or if you have to make an important decision, of course it's normal to have some anxiety. But when it's a disorder, when it becomes a disorder, that's when anxiety interferes with your ability to function. Your reactions are often out of proportion to situations. So that means you are overreacting. You can't control your responses to situations. So that's when it becomes a disorder, right? So what are the different types of disorders, of anxiety disorders? So we have generalized anxiety disorder. It's a condition caused by fear, by worry, or a constant feeling of being overwhelmed. So that's generalized anxiety disorder. So it's characterized by unrealistic worry about job responsibilities, health, and chores. Unrealistic worry about job responsibilities, health, and chores. The second type of disorder is agoraphobia. So what is agoraphobia? It's a condition that causes an intense fear of becoming overwhelmed or unable to escape or get help. So that's called agoraphobia. So agoraphobia is characterized by often avoiding new places or unfamiliar situations, right? So it's characterized by often avoiding new places or unfamiliar situations. Number 3, panic disorder. Panic disorder is when you're having multiple panic attacks happening without warning. Multiple panic attacks happening without warning. Number 4, specific phobia. What is specific phobia? It's a phobia that is when something causes you to feel fear or anxiety that's so severe it consistently and overwhelmingly disrupts your life. So it's a phobia that causes you to feel fear or anxiety that is so severe it consistently and overwhelmingly disrupts your life. Number 5, separation anxiety disorder. So separation anxiety disorder. This happens when you feel excessive anxiety when you are separated from a loved one. So you feel excessive anxiety when you are separated from a loved one. Number 6, social anxiety disorder. When you experience intense and ongoing fear of being judged negatively or watched by others. So if you feel, when you experience intense and ongoing fear of being judged negatively or watched by others. So that's called social anxiety disorder. Number 7, selective mutism. So what is selective mutism? That's when you don't talk in certain situations because of fear and anxiety. So it's like you mute yourself, right? So selective mutism, you decide not to talk in certain situations because of fear or anxiety. So what are some of the symptoms of anxiety disorder? So what are some of the symptoms? How can you tell that somebody has anxiety disorder? And what are the causes of anxiety disorder? So there are 2 different types of symptoms. There are psychological symptoms and physical symptoms. The psychological symptoms are feeling panic, fear, dread, or uneasiness. when you feel on edge or irritable, when you are uncontrollable or obsessive thoughts, when you have uncontrollable or obsessive thoughts, or when you have difficulty concentrating. So these are psychological symptoms. Feeling panic, fear, dread, or uneasiness, when you feel on edge or irritable, when you have uncontrollable obsessive thoughts, or when you have difficulty concentrating. So these are psychological symptoms. So what about physical symptoms? So physical symptoms are when you are restless, when you have heart palpitations, shortness of breath, muscle tension, cold or sweaty hands, when you have dry mouth, nausea, when you have numbness in your hands or your feet, when you have difficulty falling or staying at sleep. So these are physical symptoms of anxiety disorder: restlessness, heart palpitations, shortness of breath, muscle tension, cold or sweaty hands, dry mouth, nausea, numbness in your hands or feet, and difficulty falling or staying at sleep. So what are the causes? What could cause someone to have that anxiety disorder, to develop these symptoms? So it could be a chemical imbalance. It could be a change in your brain, right? So the change in your brain could be an increased activity in the amygdala. The amygdala is a part of your brain that manages fear and anxiety. So if you have an increased activity in the amygdala, then that will cause you to have anxiety disorder. So the third one could be genetics. So if you have your parents, your family members who've had anxiety disorder, then you could also develop anxiety disorder. Or it could be environmental factors. So the environmental factors, you could be experiencing a lot of stress, or as I mentioned last week, you could experience a traumatic event. So when you have trauma, so that could also cause you to develop anxiety disorder. So how do you get a diagnosis for this type of disorder? How can you get a diagnosis? So you could get a physical exam by your doctor. So if the doctor find that the problem is not physical, then they will refer you to a mental health professional, a psychologist, a therapist, or a psychiatrist, so for a mental health evaluation. So the diagnosis will be based on your reported symptoms and discussion of how the symptoms interfere with your daily life, and observation and attitude of your behavior. So the diagnosis will be based on your reported symptoms, the symptoms that you've been experiencing, a discussion on how the symptoms interfere with your daily life, and then an observation of your attitude and behavior. So this is really how they will give you a diagnosis of having anxiety disorder. So how do you manage, or what kind of treatment can you have, can you receive if you have anxiety disorder? There could be a combination of medication and psychotherapy. So I will not go over the medication because they are complicated. My wife would be the one who will go over the medication with you. And what I could say is about the psychotherapy, you could have a cognitive behavior therapy where they will discuss they will help you understand your thought patterns, right? So and behaviors. And there's something called exposure therapy, where they will expose you to your fears, so that way you can confront those fears. So they will expose you to those fears so you can confront those fears, and that is called exposure therapy. So you have cognitive behavior therapy and exposure therapy, and you can also have a medication, a combination of those two, to help you deal with your anxiety disorder. So this is what I had for you today on Causez l'École. again, I know, I hope that you guys will watch this inauguration tomorrow. It's gonna be indoors because it was cold. So the last one that was indoor was President Reagan, because he was also cold. They don't want people to go outside and stay in the cold for 3, 4, 5 hours. So and I know many of us are disappointed because we don't have the president that we wanted, but this is life. This is politics. So we have to be citizens and do what we need to do. So we look forward to another election in 4 years, so that way we can vote for somebody else. Again, Trump will not be able to run. So this is his presidency, his administration. So we need to do what we can because we live in this country. So we are citizens of this country. So we cannot turn our backs on the country. So again, I wish everyone a great Martin Luther King holiday tomorrow. I wish everyone a great Sunday, and I wish you a great week. So I will see you next Sunday for another Cause L'Ecole. And let's pay attention to everything that Trump promised he was gonna do first day in office. So let's see what he starts signing on tomorrow afternoon, because as of 12, as of noon, we will have a new president. So take care. I will see you next Sunday. This was Dr. Moreau, and be blessed.